Alright, good day guys, welcome to my channel once again, Dr. Paramount, a go-to destination for orthopedic insights and practical knowledge skills. This afternoon I'm not here alone, I'm here with a certified orthopedic technologist, a person of Autocast, Amadi Stanley. He's going to be the one taking us through some things today. He's going to be taking us through some journey as regard fracture management in collaboration with first aid treatment. You know, on this channel I only give you conservative management of fractures, but there has to be some levels, some things to be done first before you treat some fractures and before you attend to some fractures in the body. Don't forget last week I talked about the management of Colles fracture. But what are the things that you're going to do as a technician or as a technologist or as an individual or as a medical practitioner? So that is why he is here to take us through some journey. So over to you, sir.
Good afternoon, everyone, and welcome to this channel once again. My name is Autocast Amadi Stanley Temitope, a certified orthopedic technologist from the University of Ilorin Teaching Hospital, Ilorin, Kwara State, North Central. I'll be taking you fracture first aid blueprints, a step-by-step guide to accidents, site management, and casting. Firstly, what is first aid? First aid is the initial treatment given to a casualty at the point of injury and at the site of injury before the arrival of an ambulance, a doctor, a nurse, an orthopedic cast technician or technologist, or a certified first aider. Another thing I'll talk about is the aims of first aid. The aims of first aid are just three. We have to preserve life, to promote recovery, and to prevent the condition from getting worse. I'll define fracture also because we are talking about first aid and fracture. Fracture is a break in the continuity of the bone, as you all know, and it can be displaced or not displaced. The part one of this lecture is the accident site management, and I have like 8 steps or 7 steps which I'll be taking to. The first step is assess the scene and ensure the safety. You assess the scene of the incident, like we're saying, fractured patients, and we are applying first aid for the patients. At the site of injury, we make sure we assess the scene and ensure patient safety. The second one is ensure the area is safe before approaching the injured person. We ensure the area is very, very safe. Let me give an example. A casualty that was involved in an accident on Lagos-Ibadan Express Road, and you as an orthopedic technician or technologist, you're on your way back home from school or from work. Seeing the patient, so seeing the casualty, you come down, oh, I want to help as an health worker. You come down, you see that the environment is not safe for the patient that has fracture. People are shouting here and there, and here you want to apply your first aid skills to help the patient, the casualty. You have to clear the way. Tell them to move back. If the patient is on the main road and the vehicles are still passing, you just move the patient gently to the part of the way. So by this, you are ensuring your own safety and the casualty safety. 2, look for hazards like traffic, fire, or unstoppable structures, and to move the patient area if necessary. You look for any hazards that can happen again. That, oh, this patient, let's move this patient from the point of the accident. So we are moving the patient from the scene of the accident to a very safe and good place that there is no hazard or fire. There we can start the step 2. The step 2 is evaluate the casualty's condition. You have to check for the casualty's condition. Check if this casualty is being responsive. Ask, madam, sir, what is your name? If the casualty is still responding well, fine, you can carry on with the other steps. Then you check for breathing also and signs of shock, because you want to avoid the patient from falling into shock. The next one is look for visible fractures, swelling, bleeding, or deformity. You look for the fracture sites, like the patient is complaining of, this leg is paining me, this hand is paining me. Check as an orthopedic technician or technologist, you check, is this a fracture or a sprain or a strain? You check it. After checking, you see swelling. Fine. If you are experiencing or you are seeing the fracture, you will expect swelling. Swelling is anticipated. When you see the swelling, you know, okay, fine, this is the bone that is fractured here. But as a first aider, you apply your skills. Check for swelling, check for bleeding, and check for deformity of the limb. Ask about the pain and inability to move the affected limb from the casualty. You ask, mommy, daddy, can you move this limb? The patient might tell you no or yes. If they cannot move the limb, then you know where to come in. This takes me to step 3. immediately call for help. You can call the emergency response unit, you can call the ambulance that, oh, there's a casualty along so highway. Before the helps arrive, then you can now provide your information about the patient's condition. Tell them about the condition. The patient sustained a fracture or a sprain. The next step is step 4. You immobilize the fracture. Let's assume a patient has a fractured tibia or fibula. You try and immobilize it. How will you immobilize? On the highway like that, you can get a plank, you can get sticks, you can cut bushes. You take the trees and you add it, you immobilize with an handkerchief also, or a rope. You can get a rope to immobilize the fracture. Why are you immobilizing? You are preventing the casualty's condition from getting worse. That's what will take us back to the aims of first aid, which is to preserve life, to prevent condition from getting worse, and to promote recovery. Your immobilization will serve as a very vital management, because if you do not immobilize the patient fracture, let's assume the patient have a spiral fracture. That's one of the patterns of fracture, which can actually pierce through the soft tissues in the body, and the patient is just being moved anyhow. You know, you can actually damage the patient's limb with that. So hereby, you just try and immobilize the patient fracture. The next one, do not move the fractured limb unnecessarily. Don't try it. It's a very, very dangerous thing to move the fractured limb unnecessarily. People, I think, they are helping patients. I don't blame people, because some people don't really have the first aid knowledge of attending to patient or saving the patient. You might be thinking of trying to save the patient. Your intention is to save the patient, but on the other hand, you are damaging the patient unknowingly. You are damaging the limb unknowingly while you are trying to help. The next one is apply a splint to stabilize the bone. Apply a splint. What do we mean by a splint? Is like a device you can just get a plank, get a stick. It will serve as a splint to the patient before the emergency helps come. Use rigid materials like woods, cardboards, or rolled up newspaper. Even if you don't have planks, you don't have trees, you can get a newspaper or papers. Even if it's just paper and rubber band, you can use that as a splint. The next one is secure the splint with bandages or stripes of cloth without cutting or circulation. There, you can use a crepe bandage. If you get a crepe bandage or a cotton bandage to apply to the splint, or use an handkerchief or tear part of the patient's clothes to hold the splint in place. The next one I'll be talking about is, let's say the fracture is an open fracture and the bone is pressing through the bone. An open fracture is a second type of fracture by which the bone is fractured and is communicating with the external environment. That means the bone is pressing through the skin. Please, on no occasion should you push back the bone. Don't try to push back the bone. Just try and immobilize, try and stop bleeding. And this takes us to step 5, which is control bleeding. You have to control the bleeding with sterile materials. Let's say you are in the bush, you can get a very clean clothes, and if you are opportune to get cotton bandage or other type of bandages, you can actually use it to stop the bleeding for the time being. Apply gentle pressure around the wound with a clean cloth or bandage. Avoid excessive pressure on the fracture site also. Step 6, reduce swelling and pain. You elevate the injured part to reduce the swelling, because normally in the fracture site limb, swelling is always anticipated. Then the last step, but not the least, is the step 7. Transport the patient. You make sure you transport the patient carefully on a stretcher or a firm surface. You cannot even get the stretcher. If you can get a plank, a very big plank, or a 2x2 plank, and we can get 2, make sure you carry the patient gently on the plank. After splinting the fracture side, you can move the patient to the hospital. You don't carry the patient like a married bride. No, it is wrong. The next one is special consideration for different types of fractures. For open fractures, I told you the other time, I said do not push back the fracture. Then for spinal fracture is always very, very, very dangerous. If you suspected a neck or back injury, you don't just carry the patient anyhow. If possible, you can get a book or a carton or a cardboard. You get it and use it as a cervical collar to the patient's neck for you to avoid further injury, to prevent that condition from getting worse, to avoid spinal cord injury. The patient might just have a fractured neck or fractured cervical bone, but while you're carrying the patient, you are just carrying like a bride on while you are trying to help the patient. If you are not being careful, you might damage the patient's life forever. That the patient will not be able to stand straight again. Then another thing is fractured fingers or toes. If there's fractured fingers or toes, you use, let's say this finger is fractured, you use this other unaffected finger, which is also called the residual finger, to immobilize. You now use a tape or a rope to tie it together. Please, are we getting it? You tie it together. That's the way of immobilizing a fractured finger or toe. The next one I'll be talking about is the importance of first aid in the management of fracture. You know, first aid is the first or initial treatment given to a casualty at the scene of accidents. Let me just call it short like that. Now, for someone that immobilized the fracture site at where the accident happened, at the accident scene, one of the important is it will prevent further injuries. Further injury examples are nerve damage, compression, circulatory disturbance, and muscle damage also. Those are further injuries that your first aid will prevent. The second one is the reduction of pain. First aid helps in reducing pain because since the fractured limb is fractured already, you have to help immobilize. The splints you apply will serve as a pain relief without even giving your patients drugs or any pain relief. That will serve as a pain. The next one is control bleeding and infection. You can control the bleeding by stopping the bleeding at the accident site, and also controlling the bleeding and covering up the wound. Thereby you already clear the road for infection. Infection cannot enter again. The wound cannot be infected because you already cleaned and maintain the wound. This next one is support faster healing. It supports the prognosis of the fracture. What do you mean by prognosis is the time of healing of a fracture. It supports and helps in the faster healing of the fracture site. The next one is it also preserves life, like one of the aims of the first. It preserves the patient. The next one is it promotes recovery. It also promotes the recovery of the patient because you already help immobilize the fracture before the patient is even taken to the hospital. So thereby you already help the nurses and the doctors and even orthopedic technicians and technologists that whenever they are applying their career, wow, the person that did this first aid helped us in the management of the fracture. In summary, acting quickly and correctly can mean the difference between a full recovery and a long-term disability or even death. Imagine you saved a patient's life. You know, saving the patient's life is you applying a splint to the fractured site, and you help the patient stop the bleeding. You already saved the patient's life, and you save the patient from a long-term disability because the patient cannot use the leg to work again or has a limb length discrepancy. That means one leg will be shorter than the other. You know, the patient already have disability for life that cannot be stopped and that cannot be recovered. So that's one of the main advantage of the first aid. Then let me give you key takeaways. I'm writing up already. I just have 3 of them. Quick action at the accident site can prevent complications. It can prevent complications in the sense that the nerve might not be injured, the blood vessels are intact, the muscles are good, they are not exposed to dangers. That's your first takeaway. The second one is proper immobilization reduces pain and prevents further injury. Proper immobilization also it reduces the pain and prevents further injuries like nerve injury, muscle injury, blood vessels, compression of other vessels also, and soft tissues. The next one is casting ensures stability and promotes proper bone healing. Casting ensures stability. We all know that that's the main reason you are applying your cast to immobilize the patient and to make the fracture stable as long as the cast is still there. So please, this is the last point, and I will want you to take note. And please make sure whatever you are going, whatever you are doing, assist another, and make sure your first aid is good. Make sure whatever situation you find yourself, you can apply the first aid to save a life and to save someone from being disabled for life. Thank you, Prof, for bringing me up to this. I really appreciate this opportunity, and I will never take it for granted. Thank you so much for this.
Oh guys, this is so interesting, and it's so educative. You can't afford to miss this one. As an orthopedic technician and technologist, there's no way you want to be serious about this casting materials, casting method, and casting procedure without having the knowledge and the basis of first aid management. That's why we brought a certified technologist in the aspect of first aid management and also fracture management to this platform to come and give us some patterns. And I hope and believe you've enjoyed this lesson. So feel free to go over this lecture again and just get something straight as regards fracture management in collaboration with first aid. What are you going to do? Are you finding it difficult to see any fracture victim at the site of incident? You're just helpless. You don't know what to do. You don't know what to carry. So it's going to be a great liberation to everything. So thank you very much, sir, for honoring our invitation. So we'll be so much honored to have your presence some other times. All right, guys, this will be the end of today's lecture. Feel free to go by the link and make sure on this channel you subscribe. Make sure you subscribe. Make sure you click on the notification bell so as to get notified anytime new videos are posted here to get proper management and proper knowledge of conservative management of fractures. And make sure you don't forget to like and comment and share. All right, in the next class I'll be talking about some other management of fractures. See you there.